Our next topic is all about pelvic wall. This is the structure of a male pelvis, and those are the parts of the male pelvis. And I have also have the structure of the female pelvis. As we can see, the parts of a female pelvis is the iliac crest, the anterior superior iliac spine, ilium, the right and the left ilium, the sacral promontory, sacrum, the ischial spine, the coccyx, pubic bone, pubic symphysis, and the pelvic brim. Before we dig deeper to the topic, we need to know first the definition of a pelvis. The simple definition of pelvis is a bowl-shaped bony structure. It protects the terminal parts of the gastrointestinal tract and the urinary system and the male and female internal organs of reproduction, and it also contains important nerves, blood vessels, and lymphatic tissues. The pelvis is the region of the trunk that lies below the abdomen. Although the abdominal and pelvic cavities are continuous, the two regions are described separately. The bony pelvis' main function is to transmit the weight of the body from the vertebral column to the femoris. In addition, it contains, supports, and protects the pelvic viscera and provides attachment for trunk and lower limb muscles. The bony pelvis is composed of four bones: the two hip bones, which form the lateral and anterior walls, and the sacrum and the coccyx, which are part of the vertebral column and form the back wall. The two hip bones articulate with each other anteriorly at the symphysis pubis and posteriorly with the sacrum at the sacroiliac joints. The bony pelvis thus forms a strong basin-shaped structure that contains and protects the lower parts of the intestinal and urinary tracts and the internal organs of reproduction. The pelvis is divided into two parts by the pelvic brim, which is formed by the sacral promontory, anterior and upper margin of the first sacral vertebra behind the iliopectineal lines, a line that runs downward and forward around the inner surface of the ilium, and the symphysis pubis joint between bodies of pubic bones anteriorly. Above the brim is the false pelvis, which forms part of the abdominal cavity, and the true pelvis is located below the brim. The orientation of the pelvis is in the front of the symphysis pubis, and the anterior superior iliac spine should lie in the same vertical plane. This means that pelvic surface of the symphysis pubis faces upward and backward, and the anterior surface of the sacrum is directed forward and downward. False pelvis is bounded behind by the lumbar vertebrae, laterally by the iliac fossae and the iliacus muscles, and in front by the lower part of the anterior abdominal wall. The false pelvis flares out at its upper end and should be considered as part of the abdominal cavity. It supports the abdominal contents, and after the third month of pregnancy helps support the gravid uterus. During the early stages of labor, it helps guide the fetus into the true pelvis. A true pelvis has an inlet and outlet and a cavity, and the walls of the pelvis are formed by bones and ligaments that are partly lined with muscles covered with fascia and parietal peritoneum. The pelvis has anterior, posterior, and lateral walls and an inferior wall or floor. The anterior wall is composed by pelvic surfaces of the bodies of the pubic bone, the pubic rami, and the pubic symphysis, and is the shallowest wall. Another wall, which is extensive in nature and is composed by the pelvic surfaces of sacrum and coccyx, is the posterior wall. It's lined by piriformis muscles with their covering fascia. The lateral wall is composed of the pelvic outermost layer of the hip bone below the inlet, the obturator membrane, the sacrotuberous and sacrospinous ligaments, and the obturator interus muscles with its covering fascia. And the inferior wall is composed by the pelvic diaphragm, which in turn is created by levator ani and coccygeus muscles with their covering fascia. The pelvic diaphragm stretches across the true pelvis and splits it into the key pelvic cavity above perineum. The floor of the pelvic cavity supports the pelvic viscera. The soft tissue structures in the pelvic walls from deep to superficial are ordered as follows: the muscles, nerves, pelvic fascia, blood vessels, and peritoneum.
Hi everyone, I am Joana Mae Jabines and I am about to tackle about the pelvic wall. Our main topic for today is the pelvic diaphragm muscle, pelvic fascia, and pelvic peritoneum. So let's start with the pelvic diaphragm with its description and functions. So pelvic diaphragm. It is a wide but thin muscular layer of tissues that forms the inferior border of the abdominopelvic cavity. It is composed of a broad, funnel-shaped sling of fascia and muscle, and it extends from symphysis of pubis to the coccyx and from one lateral sidewall to the other. Muscles of pelvic diaphragm. First is levator ani. It is composed of three separate paired muscles, which is the puborectalis, pubococcygeus, and iliococcygeus. Second is the coccygeus. Together with the levator ani and coccygeus, the pelvic diaphragm is formed. Here's the functions and rules of the pelvic diaphragm. First is to support of abdominopelvic viscera in the bladder, intestine, uterus, and etc. through their tonic contraction. Second is resistance to increase in intrapelvic or abdominal pressure during activities such as coughing or lifting heavy objects. Third, urinary and fecal continence, which is the muscle fibers have a sphincter action on the rectum and urethra. They relax to allow urination and defecation. Let's go with our next topic, which is the pelvic fascia. Pelvic fascia covers the surface of the sacrum, coccyx, and muscles of the pelvic side walls, which is the piriformis and coccygeal. It is thickened over the sacrum and coccyx, where it forms a protective cover over troublesome presacral veins that may bleed during inaccurate rectal mobilization. So here are the function and rules of pelvic fascia. It is formed of connective tissue and is continuous above with the fascial lining in the abdominal walls. Below, the fascia is continuous with the fascia of the perineum. The pelvic fascia can be divided into parietal and visceral layers. Parietal pelvic fascia lights the walls of the pelvic and is named according to the muscles it overlies. Second is the visceral pelvic fascia. It covers and supports all the pelvic viscera. In certain locations, the fascia thickens and extends from the viscus to the pelvic walls and provides supports. Last topic is the pelvic peritoneum. Pelvic peritoneum is a serous membrane which lines the walls of the abdominal cavity and lies on abdominal and pelvic organs. It reflected onto the pelvic viscera and becomes continuous with the visceral peritoneum. Between its two layers, the parietal and visceral of the perineum, there is the peritoneal cavity. The peritoneum function is to support and protect abdominopelvic organs. Structures of peritoneal cavity. In males, the rectovesical pouch is a double folding of peritoneum located between the rectum and the bladder. The peritoneal cavity is completely closed in males. In females, there are two areas of note. First is the rectouterine pouch of Douglas, double folding of the peritoneum between the rectum and the posterior wall of the uterus. Second is the vesicoterine pouch. It is double folding of the peritoneum between the anterior surface of the uterus and the bladder.
Okay, and now we will be talking about the nerves of the pelvis, which includes the sacral plexus, lumbar plexus, and autonomic nerves, and much more. So an overview about the nerves of the pelvis. They perform both voluntary and involuntary functions. The parasympathetic nerves control the opening and closing of sphincters, which regulate emptying of the bladder, and they also influence sexual functions such as achieving and maintaining erections, and they also influence bowel motility. Parasympathetic fibers are also responsible for transmitting the sensation of pain. Their origin is outside the pelvis and so must be reached via the hypogastric plexuses. And let's talk about the sciatic nerve. The sciatic nerve is the largest nerve in the body. This nerve is formed by the fourth lumbar through the third sacral spinal nerves. Then it leaves the pelvis through the greater sciatic foramen to enter the gluteal area. Next, we have the pudendal and pelvic Sphlanchnic nerve. The pudendal nerve innervates the muscles and skin of the perineum, and this nerve is formed from the second to the fourth spinal sacral nerves. It exits the pelvis through the greater sciatic foramen and enters the perineum through the lesser sciatic foramen, which then innervates the skin of the perineum. While the pelvic Sphlanchnic nerve innervates the pelvic organs. These nerves stem from the second to the fourth sacral spinal nerves. And then we have the superior and inferior gluteal nerves. As by the name, they suggest that they innervate the gluteal muscles. The superior gluteal nerve, which is this one over here, is formed in the fourth lumbar through the first sacral spinal nerves, while the inferior gluteal is found right here, which is formed by the fifth lumbar through the second sacral spinal nerve. And we have the nerve to the Quadratus femoris. Again, suggested by the name, it innervates the Quadratus femoris muscle, which is basically your hip muscle. And it is found over here. The nerve to the Obturator internus, again by the name, innervates the Obturator internus muscle, which innervates your hip muscle. It is found over here. The nerve to the piriformis, again, innervates the piriformis muscle, which is found right here. Nerve to the piriformis is found right here. Okay, now we have the posterior femoral cutaneous nerve. This innervates the skin of the perineum and the back surface of the thigh and leg. And it is found right here by the pubis, third one from the left. And now we have joints of the pelvis. A little overview. The joints of the pelvis include the sacrococcygeal, lumbosacral, and pubic symphysis, and sacroiliac. The pelvic joints are also held together by various ligaments, which include the sacrotuberous, sacrospinous, and iliolumbar, but we won't talk about the ligaments right now. Okay, now the sacroiliac joint. The sacroiliac joint is a synovial articulation between the sacrum and ilium, which is this one right here. Basically the joint between the sacrum, which is this one, and the ilium, which is this one. Okay, the sacrococcygeal and the sacroiliac joint. So the sacrococcygeal joint is a fusion of the bone between the sacrum, which is this one, and the coccyx. which is the bottom part here. Okay, pubic symphysis. The symphysis of the pubic bone is covered by a hyaline cartilage and may have left a cleft, and it is located right here, this blue area right here. Now we have the surface anatomy of the pelvis. And this illustration just shows where the pelvic bone is as a whole compared to what we see in our outer body, like where the pubis is, where the ilium is, sacrum, coccyx, and all that. And now we move to the next presentation.
The pelvic wall. Arteries of the pelvis. Each common iliac artery ends at the pelvic inlet in front of the sacroiliac joint by dividing into external and internal iliac arteries. The external iliac artery runs along the medial border of the psoas muscle, following the pelvic brim, and gives off the inferior epigastric and deep circumflex iliac branches. It leaves the false pelvis by passing under the inguinal ligament to become the femoral artery. Arteries of the true pelvis. The following arteries enter the pelvic cavity. The internal iliac artery passes down into the pelvis to the upper margin of the greater sciatic foramen, where it divides into anterior and posterior divisions. The branches of these divisions supply the pelvic viscera, the perineum, the pelvic walls, and the buttocks. The origin of the terminal branches is subject to variation. Branches of the anterior division: umbilical artery, obturator artery, inferior vesical artery, middle rectal artery, internal pudendal artery, inferior gluteal artery, uterine artery, and vaginal artery. Branches of the posterior division: iliolumbar artery, lateral sacral arteries, and superior gluteal artery. The superior rectal artery is a direct continuation of the inferior mesenteric artery. The name changes as the latter artery crosses the common iliac artery. It supplies the mucous membrane of the rectum and the upper half of the anal canal. The ovarian artery arises from the abdominal part of the aorta at the level of the first lumbar vertebra. The artery is long and slender and passes downward and laterally behind the peritoneum. It crosses the external iliac artery at the pelvic inlet and enters the suspensory ligament of the ovary. It then passes into the broad ligament and enters the ovary by way of mesovarium. The median sacral artery is a small artery that arises at the bifurcation of the aorta. It descends over the anterior surface of the sacrum and coccyx. Here is the summary of the branches of the internal iliac artery. Veins of the pelvis: external iliac vein, internal iliac vein, and median sacral vein. The external iliac vein begins behind the inguinal ligament as a continuation of the femoral vein. It runs along the medial side of the corresponding artery and joins the internal iliac vein to form the common iliac vein. It receives the inferior epigastric at the deep circumflex iliac veins. The internal iliac vein begins by joining together of tributaries that correspond to the branches of internal iliac artery. It passes upward in front of the sacroiliac joint and joins the external iliac vein to form the common iliac vein. The median sacral vein accompany the corresponding artery and end by joining the left common iliac vein. Lymphatics of the pelvis. The lymph nodes and vessels are arranged in a chain along the main blood vessels,
The nodes are named after the blood vessels with which they are associated. Thus, there are external iliac nodes, internal iliac nodes, and common iliac nodes.